My name is Kim Brooks, and I'm a member of the Taku River Tlingit First Nation. It is my honor to serve as Vice President of Regional Operations Vancouver Coastal with the First Nations Health Authority. I acknowledge that I am on the unceded lands of Tsleil-Waututh Nation in North Vancouver, British Columbia, and I'm truly grateful to be allowed to conduct my work here. Over the last year, we have continued to work in partnership with First Nations communities and leaders, and I'm pleased to share a few key highlights from our annual report. We have continued to make progress on our new Regional Treatment and Wellness Center, hosted in Shuswap Nation territory, which will become part of the provincial network of First Nations treatment centers. We entered the feasibility stage of this new 20-bed facility and continued to support strong engagement with community health leaders to ensure that the design and development of the center remains both community-driven and reflective of the diverse needs and cultures within our region and beyond. Knowing how culture saves lives, we welcomed the regional healing modality, or ways of healing from trauma opportunity. We ensured active engagement to facilitate regional shared decision-making on this opportunity. Our model of shared decision-making supports the decolonization of planning processes and brings decision-making closer to home. We look forward to completing this work in partnership with all of the communities in the region. In partnership with Newhawk, Litwat, Haksha, Nakwakwa, Skatine, and Shamakwam, we continue to advance our First Nations-led primary care projects through community engagement and summary service planning. We are grateful to the community health directors who provided leadership and direction at every step of the way and continue to do so. In addition to service planning, we also started critical conversations with regard to governance and partnership in primary care, which remains a very complex landscape. The 3 First Nations-led primary care projects in our region are part of a provincial network of 15 new First Nations-led primary care centers in BC, and how we collaborate within this network will be critical to our success. We also saw a change in primary care network governance, which opened the door to review how current practices are not meeting the needs of First Nations communities and people. Moving forward in partnership with First Nations communities and health directors in our region, we'll continue to build on working relationships with Ministry of Health, Divisions of Family Practice, Vancouver Coastal Health, and other partners to improve availability and access to culturally safe primary care services. Over the last year, the toxic drug crisis has been unrelenting, and we saw the increase in risk for women and youth. Through engagement at sub-regional and regional caucuses, regional health director meetings, and more, we ensured regional spending remained in line with community priorities. We prioritized expanding funding, harm reduction education, and building capacity at all levels within communities when requested, and within our regional team as we continue to navigate the crisis. To advance the work, we will be expanding community supports, enhancing partnerships, and continuing to develop culturally safe resources and services. Cultural safety, humility, and anti-racism remain a core foundation of all of our work in the region. We continue to work in partnership with community, Vancouver Coastal Health, and Providence to advance our First Nations-led complaint process and emergency response pathways. As part of our ongoing commitment to regionalization and bringing services closer to home, last year we transitioned full operations of Kitasoo High Nursing Station and Newhawk Nursing Services from our central office of the Chief Nursing Officer to the Vancouver Coastal Region. This was a transformative milestone in regionalizing these provincial nursing services. We also made an important decision to restructure existing positions in order to bring back the Regional Executive Director role and to establish an Aboriginal Head Start position that is no longer a shared position with Fraser Salish. These important changes enhance our ability to remain responsive and in strong partnership with the communities we serve. Last year, our regional health emergency management team partnered with First Nations communities to strengthen community-level emergency and crisis response through capacity building internally, as well as bringing training and skill building into community and closer to home. The team also focused on strengthening relationships and advocacy with system partners to support them in moving towards decolonizing their processes, working with communities in emergency and crisis response in a culturally safe way, and sharing in the development of a new complaints pathway as we continue to address Indigenous-specific racism in this field. For more information on these regional highlights and additional regional projects, initiatives, and efforts, please review our annual report available on fnha.ca. I offer my sincere gratitude to each person who has contributed to this important work. We look forward to our continued partnership for the journey that still lies ahead. Ah, Chlan Gunach Chish.